Hello everyone. Good afternoon and thank you for joining us. We are ready to start today's subject, and that's on shin pain and why we don't use the term shin splints in 2021. It's a topic that a number of you have asked for over the last few months. We obviously did a couple of similar topics a while back on stress fractures, stress reactions, which we'll be touching on today. But today really was a chance to make people understand why the term shin splints is not something we tend to use. So we're going to get straight into it. There's quite a lot to cover, and obviously we'd love you to have some questions that you can ask along the way. Just type it in, we'll look out for the comments there, but hopefully everything will be covered today. So we talk about the word shin splints. Let's start with that. It's a no-no in my books. As a very experienced physiotherapist, generally always around sports injuries my whole career, the last 20 years, it's something I've never felt comfortable with. It's the kind of term that I would put in the same bucket or pigeonhole as sciatica, as arthritis, particularly a touch of arthritis, or runner's knee, cyclist's knee, and these kind of terms. We just don't feel comfortable. Why? It's too generic. That's the first thing. Shin splints is a very generic term that does not give clarity in terms of a specific diagnosis, much like sciatica and similar terms. So therefore, the specific diagnosis and the treatment cannot be as specific and neat if we're going to use such generic terms such as shin splints. If you think about the imagery, and you ask yourself, when you hear the word shin splints, what do you think about? And if you want to put any comments on that, I'd love to hear what people think about when they hear the word shin splints. It creates some very strange images in your mind. So what do you think about it when you hear this phrase? It's interesting considering that many of the conditions that we will talk about today do not involve the shin bones themselves. So does the imagery of the word of the shin splints have the same negative outcome that things like sciatica do for the lower back? And we talked about that a few weeks ago when we did sciatica. So I've never been comfortable in the 23 years of being a physio of using the word shin splints. We want to be more specific. There are a number of conditions that have the term shin splints attached to it, and we're going to go through some of them today. But then if all of them are different and the treatment is different, then using the term shin splints does not make sense in exactly the same way that we talked about with sciatica and things like that. So we're going to talk about the negative impact of the words, put that shin splints in the same pigeonhole or the same wastebasket that we put sciatica and runner's knee, and talk about specific shin presentations today. It's even worse if you make what we would call the mistake of using Dr. Google for something like shin splints that will inevitably take you to the wrong website. Last year we did one presentation that might be worth watching, saying about the pitfalls of Dr. Google, where they did a big study and showed that about half of websites related to medical conditions were factually incorrect, misleading, scaremongering, possibly marketing-led, and shin splints would be a classic example. If you put that into Google, you have no idea what website you might land on, and the chance of it being relevant to your pain will be very poor, which the research has supported. It's very important that shin splints is seen as that. We're going to talk about 3 common forms of shin pain today that's very common in runners and walkers, but it does not have to be for these activities. Many people get these kind of shin problems from daily life, which may involve walking, and it may be involved into activities that aren't walking and running as an exercise. So it's relevant for everyone, but certainly the runners and the walkers tend to be the people that present with shin pain. So we're going to get straight to the first one, and this is called compartment syndrome. People may or may not have heard of it. It's possibly the most common condition we see in clinical practice relating to shin pain. It's one that you definitely want to avoid Googling, because you'll probably come up on a landing page that will show someone having surgery. Acute compartment syndrome, that we'll touch on later, is very, very rare in the form that would require surgery. In about 23 years, I think I've had 2 or 3 patients that have had surgery for this. It's the exception, but the websites on Google might show you a picture that would make you think it's the norm, but that's not true. It's more the lower intensity chronic compartment syndromes that we see all the time. Very common in runners as a chronic condition that can keep on going if it's not addressed. So what is compartment syndrome? I'm going to show you a picture that will help to explain it. You'll see on this picture a whole lot of colors on that diagram there. Now, the shin is unique. Unlike the thigh, unlike the upper arm where the biceps are, you have actual compartments. And you see on this picture, there's your bone, that's your tibia, there's another bone, that's your fibula, the white things. The other 4 colors, purple, green, dark blue, and light blue, are compartments with walls that your muscles and your nerves blood vessels run through. Unlike the thigh, that your quads could keep on growing and your biceps could keep on growing because there's not the same compartment structure. In the shin, the walls are a barrier to growth in terms of muscles in this space. So the other picture, you can just see if you did a cross section, and that's what you would see. That's sliced through the lower leg. And you can see those compartments, those 4 colors. The reason that's important is to understand what compartment syndrome is. Basically, as the muscles, particularly if exercising, expand, the pressure of the muscles within the compartment space increases, and if you're developing a compartment syndrome, the walls become that barrier for the pressure to increase, which is why someone with true compartment syndrome will feel a building up of pressure. Makes perfect sense. The walls of the compartment can't expand, unlike the biceps and the thigh muscles. Therefore, the pressure increases, exercise, the muscles expand, and then after exercise, the person's pain will normally reduce straight away because the muscles aren't expanding anymore. Therefore, the pressure is reduced. That's not a long-term preventative technique to stop exercising, quite the opposite. But that's why the pattern of pain is such that. So it's really important understanding what compartment syndrome is, build up of pressure. Unlike other muscle conditions that might improve as you warm up, compartment syndrome doesn't tend to have that response, which makes sense from the reasons I've said, whereas a tight muscle as a condition would often find the person warms up and feels better as they go along. So compartment syndrome, completely the opposite as a rule. Why does it happen? Well, if we look at my shin, and I've just got some numbers on me that you'll just be able to see. Where I'm pointing here, that's in one of the compartment areas. I've got a little number 1 there. And that muscle, which is this shin muscle that we've got tibialis anterior, often has to overwork. And in 99% of the cases of compartment syndrome, it's because the calves at the back of the leg are so tight. So therefore, if I go side on and I put my foot here and I have tight calf muscles to lift my foot up in that direction as I'm walking or running, these muscles at the front, where I've got that number 1, have to work so hard to get that foot to move up because the calf at the back is so tight. Therefore, the muscle works harder than what it should. The expansion can happen rapidly during exercise, and therefore the tight calves causes an increase in activity beyond what we would expect, and that causes the build-up of pressure. As a rule, the calves are always involved, we find in clinical practice, with compartment syndrome in this type of presentation. So therefore we have a cause, and that's why the pressure builds up. What's the treatment? Well, certainly when it's very inflamed after you've been walking or running, if that's your pattern and it's inflamed, that icing is important. You get that ice on that inflamed muscle area as soon as possible, very aggressively, very intensely. Let's settle it down. So then the inflammation from the muscle pressure, that feeling of bursting, you reduce it. But really the long term, let's look at the cause, and that's the calves. And that's why previously stretching was kind of used. But if we look at a calf stretch, I might do a calf stretch with one leg at the back. I've got to use my shin muscle to help me get that leg forward. And if you've got poor calf shin muscle control, you could actually make it harder doing a calf stretch. So we don't tend to use stretchers for that calf tightness. We tend to use the foam roller. We'll be talking about the foam roller later on, but it's vital you get to the deep calf muscle where all of the tightness is, to relieve that tightness, and that will make the shin muscle work so much easier without having to exert so much pressure through that compartment. So that's really important. Once the calf muscle is loose, we move to the strength phase of compartment syndrome, which can be quite early on, within days of someone presenting, to rebuild the strength between the calf and the shin muscles. That's what we want, a nice balance. If we look at here, from side on, you can see calf muscles at the back, I'll just point to them, shin muscles at the front. We want a nice balance between the two. So what exercises do we tend to use? In previous world, we might have done straightforward calf raises. Double leg, single leg, straightforward, but not really these days. We tend to be a bit more specific. If the person is able to, and I'm going to use the foam roll to show you, if I go into that position, you can see I'm near the skeleton there, but I'm going to be using him later on. We're in a plank position, and we do our calf raises, heel, toe, double leg, take one leg up, single leg. My calf muscle has to work perfectly. My core muscles are helping to stabilize my shin muscle does not need to work in that exercise, which is my goal, to make sure the good muscles are working in the context of compartment syndrome, your core, your calf working together to tell the shin muscle not to be involved. That exercise, when done pain-free, should translate to a pain-free walk or running, depending on your activity. That's really important to get that control back from plank calf raises in the context of compartment syndrome. You can then move to more dynamic exercises, which might be things like hopping with control, where you're teaching yourself to push off that little bit harder and faster and further than the plank calf raise. And that's the strength part of compartment syndrome. People will always pull out the R word, rest. Compartment syndrome, I wouldn't advise that. Rest won't change the tightness of the calf muscles. Impossible. You rest for 1 day, 1 week, or 1 month, the tight calf will still exist. Rest won't make the weak muscles stronger. In the context of the exercise I just showed you, same result. So don't matter how long you rest with true compartment syndrome, you're still going to get the same outcome on that return, walk, or run if you haven't loosened off the cores and you haven't strengthened the weakness. Very, very important. So that's a compartment syndrome. The acute version, I'm just going to touch on the medical one that you might see on the internet. When the pressure gets so much, it can compromise nerve and blood supply. People get tingling and all sorts of symptoms down the legs. They can be medical emergencies, but those ones are very, very easy to pick a mile away. And if that happened, I think you certainly would know, because you pretty much take yourself to a doctor or an emergency situation. But as I said, acute surgical compartment syndrome is very, very rare and not something that we tend to see in clinical practice. The second condition we're going to go to now is medial tibial stress syndrome, or MTSS for short. And this is probably the closest to what people's perception of shin splints is. It's an overuse injury, very common in runners, and some studies have shown that maybe up to a fifth of running injuries may be medial tibial stress syndrome. And I'll talk about what it is. In terms of where it would affect, and I'm just going to get the right picture so you can see. These are the pictures of the shin, and you can see the picture on this side is more the front, and this side is more the back. You can see where the arrows are there, and it can be different parts of the shin. But in a nutshell, if I kind of point it to my leg here, you can see there is on the inside. Number 2 is where I've labeled it, on the inside of the shin bone. That's probably the best way of saying it. Medial means on the inside. So on the inside of the shin bone, not the shin bone itself. So from front on, that's the shin bone. On the inside of the shin bone, it's really the tissues attaching to the shin bone rather than the shin bone itself. And what happens when the tightness is there in the area, and it's normally the calf muscle, the deep soleus calf muscle, that's your deep calf muscle, very tight, it has forces on the attachment to the shin bone, like traction forces, constantly tugging on the inside of the shin bone where I was pointing on my leg. So therefore it can cause inflammation and pain, and the medial side on the inside is the most common place, hence the label medial tibial stress syndrome. Studies have shown that it's not an inflammation of the bone itself, unlike stress reactions and stress fractures that we'll talk about next. So sometimes medial tibial stress syndrome and stress fractures and reactions get merged together, and they shouldn't, because they're definitely very different. We can see a difference in our assessment because the palpation of the bone will be very different to the palpation of the tissue next to the bone. And I will commonly say to the person presenting with shin pain and say, look, this is your bone. How does it feel? This is the bit off the bone, and in this particular condition the difference is black and white. It's not tender on the bone, and it's extremely tender just on the side of the bone where the problem is. So it's a very fast responding injury, this one, when it's this particular presentation, when the cause of the problem, which is generally the underlying tightness in the deep calf muscles, is addressed. There are other factors we see a lot of in runners. Sudden increase in training loads, which might be frequency, distance, or speed. That's definitely something. We see it in newer runners whose muscles aren't used to doing what they're doing, so they tighten up very quickly, and then as they're going through a count to 5, this condition can sneak up quite quickly. New footwear, old footwear that should be replaced, or inappropriate footwear are all triggers for this condition, and it's different for every person, and it's important to have a look at that footwear part of it, but recognizing that the calf muscle tightness may be more important than the footwear. So don't go crazy and buy shoe after shoe after shoe thinking that it's the shoe's fault. If you're on a second or third pair of shoes, I'll be thinking maybe it's not the shoe after all. So that's really important. The treatment might be a little bit different to compartment syndrome because often the MTSS is not as inflamed. The pressure of the palpation is not the inflammation, but the tightness of those deep inside calf muscles. So we tend to find they don't need to ice as much as compartment syndrome and stress reactions and stress fractures that we'll talk about soon. Actually, the loosening is really important and the angle is even more important. So in terms of the foam roller, I'm just going to face you so you can see a little bit more front on. A lot of people will foam roll nice and quickly up and down, facing the camera like this. On the medial tibial stress syndrome, we want to be on the side, on the very inside of the calf. And I'm going to go for single leg, take the other leg out of the picture, lift my bottom up, and I'm going to be on the inside of the calf. Small movements. And I will find the cause of this particular condition very easily because it will actually reproduce my pain normally 10 times out of 10. So if I'm on the inside of the calf, my hands are going to go behind, my other leg is behind, lift myself up. I'm not going to go quickly because I'm not going to find the cause. I'm going to slow it down, look for the angle, turn my foot if I need to, and find my pain. I'm not on the shin bone, I'm actually quite a long way off it on the inside of the calf. If I find that pain, and that's my pain, then really it's likely to be this condition if that's where my pain is, unlike a stress fracture or reaction where you would not feel the same on the soft bit next to the bone compared to the bone itself. So it can be a bit of a self-diagnosis clue as well. Once we loosen the deep calves like that, then the strength work around MTSS is very similar to the compartment syndrome, but possibly again we can go quite intensely with it because it's often to do with the tightness rather than the inflammation. So yes, I'll do things like plank calf raises, but I wouldn't hesitate to progress someone to a lot of single leg work, such as single leg squats. Then I might go single leg squats to a hop. Let's retrain the good muscles to work together. Lots of good muscle relationships on the bad leg there to teach the muscles to work together, particularly the calves, to have a little bit more support from further up the chain through the quads, the hamstrings and the thigh, the glutes and the backside, and again, our core muscles there. From then we go a bit more running specific, and one exercise that a lot of our sports fitters know we use a lot is things like speed skaters. A very good one for this condition. Can you go from one leg to the other laterally? So we're demanding a lot from our calf muscles for the leap, as well as a whole lot of work further up the chain into the backside, and that will see how your calf performs, particularly if you're a runner. But again, walkers can do walking version of that exercise. So that is the MTSS, the medial tibial stress syndrome. Now the third one, and again, very common that may present, is what we call the tibial stress reaction or stress fracture. It can be in either shin bone. We do get fibular stress fractures, but for the purpose of today, because of shin splints is normally on the inside, we're going to talk about the tibia. And the tibial stress reaction presentation or stress fracture is a continuum. It's really important people understand that. If that's 1% of bony involvement, what we call the smallest stress reaction in the world, up to 99%, the worst stress fracture in the world, that won't show on an X-ray, that most certainly will. It's a continuum. Unfortunately, we do not have Superman vision. We did a good talk on stress reactions, stress fractures last year, and I will copy and paste it on the thread. I do advise you to watch it if it's something you've dealt with or are worried about. We can be suspicious of a stress reaction or stress fracture, but we cannot diagnose in the absence of imaging. It's not right. We do not have Superman vision, and the truth is most small stress reactions into stress fracture land will not show in the plain film X-ray, need an MRI scan to pick them up, and then at a certain point on that continuum, the bigger stress fractures will show on a normal X-ray. But to get to that point, to justify the imaging, we need to see what is happening, because the problem is through the bone itself. And it's where the forces are repeated. It might be running, walking, change of footwear, inappropriate footwear, all of those things, but the tenderness would always be worse on the bone, no matter what angle you press it. We often find in these presentations, we can palpate way up near the knee, and the person's pain will be produced where the bony problem is, and that's a nice other way of sort of diagnosing, a bit more accurately. But again, until you have an image, you can only be suspicious of a stress reaction or a stress fracture. So what do? Well, we see what the weight-bearing status is like when someone presents, and actually, in most cases, we strengthen straight away because we need to find out, will this need an image urgently? On that spectrum, that continuum, many of them will not need imaging. Suspected stress reactions will respond favorably to strength work immediately, because the stronger the muscles are, the more support around the bone that is getting all this force being put to it unnecessarily. Therefore, again, rest is the worst thing you can do. At the other end of the spectrum, if someone had symptoms that were definitely not responding or required urgent imaging, and an X-ray did show a significant tibia fracture, and I'll just show you in the context of this picture, that would be this line when my left hand is there, that would be a tibia fracture going across, then certainly that person would probably end up in a boot, weight-bearing boot potentially, or a plaster if it's worse, and that would be in orthopedic land to see the stability of the bone. But that's definitely the exception to the rule. Most people with suspected stress reaction or fractures do very well, and those that need imaging, we would have an answer straight away. So again, if it's very inflamed, newish type pain, ice straight away. Let's get that inflammation down around where that pain is. Really, really important to see what's actually happening. If it's so tender to the touch and you haven't iced it, it's very hard to see what the strength is like when you're doing things like calf raises. So let's get the ice on. Let's loosen the muscles at the back with the foam roller, which we've talked about, and let's see, can you do your calf raises in a simple standing position? So we would see what's double leg like, what's single leg like, a little less intense than maybe the other two conditions, but if someone's making progress with the icing and the strength work and the foam rolling of the calves, we will progress them, because at that point in time, if they're making progress, the need for the image is reducing, and normally we would know in a couple of days after treatment whether it would need an image. It would either be getting better or it wouldn't be. So it's strengthening, strengthening, strengthening. For the suspected stress reaction comes stress fracture, depending on whether an image is needed. Cycling, swimming, cross-training type things, very important to utilize in this context of this injury for runners. So if you're running 6 times a week and have a suspected stress reaction or stress fracture, you certainly wouldn't be advised to run 6 times a week. You'll be getting that strength work in. We would guide you as to whether running was safe at any point in time, but those other activities can be very useful, particularly the cycling and the swimming. Obviously, COVID's made it difficult for some of these things, but it's worth utilizing if possible. So that's really important. Again, resting in the absence of an image to immobilize an injury, such as a bad stress fracture of the tibia, is not the advice we give you. Rest can be the worst thing to do. And even when people are in a boot, we still get them doing other exercises for other muscles. We've had people in boots with fractured tibias, broken tibias, doing Swiss ball classes safely, doing our weights classes safely, obviously not doing things like deep lunges, but there's always a way of getting the other muscle stronger, and it's important to realize that. So they're the 3 main conditions that we would normally say would be aligned to shin splints, and I hope you've seen that all 3 have different journeys, diagnostically, treatment-wise. Prevention is the key of shin pain, and this is why a lot of people get recurrence of shin pain, because they might have used strategies to get better, but didn't implement into prevention. That's so important, because that was the cause in the first place. So on the tightness side, on the foam rolling, don't sweep, go small distances, use your angles, look for the pain. When we do our foam roller class, which is done over video link, we go over 20 muscles, head to toe, and we show you how to do the angles of each muscle, so that when you get a knot or a pain like this pain, you can use the roller, in effect, to diagnose to get to that spot. So clever foam rolling is a preventative tool. After running, see what's tight. If it's not too bad, go to the next muscle. Always clever foam rolling will help to prevent these type of injuries. The strength work is the key, and we want to marry all of the key running muscles or walking muscles together. So we've done single leg squats today, we've done a little bit of the speed skating. Another couple of exercises I can just show you. We do a lot of our single leg deadlifts, single leg being the key for this type of injury. What happens when you go down and up with or without weights on one leg, and then you compare it to the other side? Is there a difference between left and right? Because a problem might be coming a lot further up. If that shows you're weaker on one side than the other, and you've had shin pain, then maybe it's not the shin's fault after all. Maybe the problem comes a lot further up. Another similar example is a sumo squat, which a little bit of a variation, where you go down to a squat and you go to one leg. You go down to the other side and onto that other leg. And you see, are you stronger or weaker on one side? What happens if we hop? Are we stronger on one side, going side to side, compared to the other one? Another one, jumping lunges, same thing. Are we stronger or weaker doing those kind of exercises? We bring the Swiss ball into the strength work for the runners because we can then challenge the core a little bit more, and this shows you a couple of others. I'll be slightly diagonal here. I can do plank calf raises on the Swiss ball, a bit more running position. I can lift one leg up and see with one leg in the air, am I stronger on one side compared to the other? I can do another exercise, the mountain climber on the Swiss ball. Am I stronger when I lift one leg up compared to the other? And we're often be the standing leg, that is the weak leg, not the one in the air. Take that a step further with that shape, put the ball behind the back, get that back leg behind, and then come up like you're running. Just like a running movement. And because you've got the ball behind you, am I stronger on one leg versus the other? All tests of strength to bring as many muscles as possible. Now, if there's any questions there, just pop them on. I'll certainly have a look straight after because I know we want to end in a couple of minutes there. I hope that's been really useful. We do all of our classes over video link at the moment, as you know. We have about 40 classes a week. The foam roller class, you just do the once. So you just contact us and we organise a day and a time. It takes about an hour and a half to get through the whole body. The other classes, the Swiss ball, the sports fit, particularly for the runners, the cardi fit, the lower limb class, and we've got the golf fit, the couples fit, and the Pilates. So there's a lot of choice on Video Link land at the Platinum business here. Everything over Video Link, all days and times. Just contact us for a trial. More importantly, put some questions on this thread. I'll answer them after. And if there's any suggestions for future topics over the next couple of months, please get them in. We're trying to stack the seminars up to be happening weekly. And I just hope you understand today why we don't use the word shin splints anymore in 2021. Have a great day. We look forward to hearing from you, and we hope to chat to you all soon. See ya.